only time of the year that I could say it is time for a new year and a new me. And I know you've heard this sentence before, but you never saw it spelled with a K for the new method. So we're so excited to use it every time this year. So forgive us for being corny. It is what it is. Now, this is for those of you. Today's episode is going to be a little bit longer because it's the start of the year and we need to make an impact. So, this is for those of you who've just had it. For those of you who have been going from doctor to doctor, from specialist to specialist, just to be told, hey, there's nothing wrong with you. There's no more tests to run because maybe it's your age, or maybe it's your weight, or maybe it's just in your head. Right? You already know, you've heard this. So today we're going to sort it all out. We're going to tell you about how you're going to figure it all out step by step. So today, basically, we're talking about the new method. Now, if you don't know by now, I called it the new method because my clients always know. They tell me they knew it. They knew there was something more. They knew there was something wrong. They knew there was a reason for why they don't feel well. And they always knew there was a better way. So this is it. Let's talk about the way to figure it out. This is your time to shine. It's the new year and it's time for a new you. So let's start because if you're watching this, you're probably not feeling well, right? And like I said, you've been to like a million medical appointments and you still have no answer. Or maybe you already have a diagnosis. Maybe you have a medication in your, medication closet, but you still don't feel great. Like why isn't it working? So today's episode is about figuring out the cause of your I don't feel good-itis, because you want to know what to do to get better. And there's so many things out there. Like there's detox protocols and mold tests and vitamins and supplements and hormone testing and Lyme testing. Like where do I start? That seems to be the question. Where do I start? So if you've been on this journey for more than 2 minutes, you know that there's so much out there. Like how do you know where to start? Do you get blood work first? Do you get mold testing? Do you get hormone testing? Do you buy 400 supplements? Make it make sense. So today's episode is about helping you through this maze. I'm going to give you a roadmap. I wrote a whole book about it. It's right there. I don't know if you can see it. It's In Your Head. You can get it on Amazon. But today I'm giving you the cliff notes of what's already a pretty short book, because what's better than a shortcut to a shortcut? That's what I always say. Do I always say that? No, I've never said that before. I'm saying it right now. Now, by the way, when I record these lives, it lives on for months, right? It goes on my podcast, it goes on YouTube, it goes on Facebook. So I'm not sure when you're seeing this. So help me out a little bit. If you're watching it live, tell me I'm here live. Please put it in the comments right now. Tell me I'm here live. Send me your questions. We're going to answer it. If you're watching it on replay, let me know. Drop the word replay. You could still put your questions here. My team will see it and they'll ask me and we'll get back to you. If you're watching this on YouTube, hello, hi. Click the like button, click the subscribe channel. You know you want to. Don't be cheap about it. Just do it. And if you're listening on the podcast, hi. My hair looks pretty good. Not a lot of gel today. And if you don't know by now that I'm on TikTok and on Instagram, get out from under the rock and find me there because I give all kinds of information on each platform. Oh, and one more thing. If this episode speaks to you, you should consider becoming a member of our community where you will get access to my It's Not in Your Head video series. And you'll also get access to our community where you'll be able to suggest topics for me to talk about, because every month I'm going to be adding in-depth topics. So the link will be somewhere. I'm not sure. I'm sure my team will put it somewhere. But if you like these type of lives, consider joining the community. All right. It's the start of the year. And like I said earlier, so many people don't know where to start. And I don't blame them. It's overwhelming. So there's 4 categories of people that come my way. Tell me which one is you, or tell yourself, or tell me in the comments somewhere. 1, there's the I don't feel good-itis crew, right? Maybe you're tired, you find yourself dragging, you're not sleeping well. Things are just not like they used to be. But when you go to your doc, your NP, or PA, they say, the labs are fine. This is just a normal part of aging. Or what do you expect? You're stressed out. What do you expect? Lose some weight. You're older now, right? You're a mom. You're this, you're that, right? That's the I don't feel good-itis crew. It's the I don't feel good, but I don't really know why. The second crew is the crew that, like I said earlier, maybe you're given a diagnosis. Maybe you're told you have Hashimoto's, blood pressure, diabetes, and they give you a medication. They say, hey, I'll see you in a few months to monitor it. Come for refills. End of conversation. You're fine. See you in 3 months. but you don't feel fine, right? You're taking the medication and things aren't feeling fine. And you're also wondering, is there a way to get off these medications? Group number three. Group number three maybe has a little bit more of a complicated diagnosis. Maybe you have some autoimmune issues. Maybe you have a few medications. Maybe you have some flare ups, some good days, some bad days, some days when you're just out for the count, and then some days when you can like kind of get through. Maybe you have multiple specialists. Each one manages a different body part, right? You have the one guy that does your stomach and the other guy that does your joints or gal, another person that manages your skin, and no one offers a conversation that, hey, maybe all of this is connected. Like maybe one part of your body actually affects the other part of your body. But no, that can't be the case, right? Because you have two different specialists in two different offices. So they never talk to each other. So obviously none of this is connected. It just all happens to be in your body. And then the fourth group is the people who really are feeling okay. They're fine. They come to me and they're like, no, I'm good, E. I have no complaints. God bless. But I really am worried about my future, right? I'm really worried about, I want to make sure I'm optimizing my health. I want to make sure I'm preventing some issues down the road. And I want to make sure I don't just live longer, but I live longer well. And you guys go to the PCP every year, you do your annual, and you get like this report card that says you're pretty good, right? And your PCP says, hey, as long as your labs are good, things are good. You don't really need to do anything else. And if you say, is there anything else I should do? And they're like, no, see you next year. Okay, so if you're one of these four, you're in the right place. And if you're not one of these four, tell me which category you're in because I must be missing a category. I think I covered it. Let me know if I missed a category. So here's what I want you to know, whatever category you're in, right? None of this is fine. It's not fine. It's not fine not to feel well and not know why. It's not fine to just take medications and see you in 3 months, not have a backup plan. It's not fine to not to have a conversation of how do I get off these meds, if at all. It's not fine to have 12 different specialists who like don't talk to each other and don't consider that things might just be connected. And it's also not fine that if you feel great, that you don't have a conversation about preventing and good longevity, right? And let's just wait until something shows up in the labs and be reactive about it. It's not fine. None of that is fine. We have to figure out what to do with all this. Now, I say this in every video. You are not allowed to embark on this journey with me if you didn't start with your PCP. You have to go to your conventional medicine provider, your doc, your PA, your NP. You cannot skip that step. Those four groups I told you about, those four groups of people that come to me, they all went to their PCP first. You have to go. Even if you get no answers or partial answers, do not skip the step because you always have to rule out a pathology, something serious. And if you need medication, you're going to start them. Okay. This is not an either or conversation. If you're not feeling well and you've never had blood work or imaging or visited with your PCP, shut this episode right now. Go make your appointment because you have to start there. Do not diagnose yourself based on this episode or anything else in the worldwide interweb. Okay. The clients I work with already had a million tests, images, appointments. They come to me when they don't know what to do next. So you have to do that as well. Now, when they come to me, I'm not saying I'm smarter than any of their current medical providers, right? These people are amazing. They went to school, they're smart, they're caring. It's just that I have a different approach and I have a different skill set to see how all the things are connected. Okay, when I sit with my patients, we go back from like birth. And I have a gift, thank you, of being able to take all this information that you've gathered along the years and make it make sense. I connect the dots and then I help you create a plan. But I will only take on a consultation if my client has already had all the tests first. So never ever skip that step, please. Now, yes, so when you work with me one-on-one, it is all customized to what's going on in your life, but there is still a basic framework that I use as a guide. That's why it's called the new method. I have a method. And today I'm sharing this framework with you. And if you become a member in the new method community, you'll also get more of a deep dive video to understand the framework. But we're going to go through it today. I need you to know like a little bit of a background. I need you to know like how I got into this crazy world. Okay. Like where did I come from with this craziness? Okay. Because my story is your story. And that's important. You need to know where I'm coming from because I initially went to school and I became an FNP, family nurse practitioner, and I opened up my own practice. It's called EG Healthcare. E, G is my wife, EG Healthcare, and everything was great. I have a great primary care practice. We see over 20,000 patients. My schedule was full. It's thriving. And I could have just kept on going. Like, why? But instead, I went back to school. I started all over again. Had to learn so many things. I had to unlearn so many things. And you know what else? I had to face a lot of ridicule by some of my colleagues who think that all this is like quackery. I'm sure you guys out there who are making some changes, some of the people in your circle are also telling you you're crazy. You're not. So, why did I do it? Why did I go back to school? Why did I go to study functional medicine and get certified? Why did I get my PhD in integrative medicine? Why do any of you listening right now go down this rabbit hole? Like, why are you here right now listening to me instead of watching some reality TV show, right? Because I'm sure so many of you kind of still wish you never entered down this rabbit hole, right? You wish you could unknow what you know now. And the answer is the reason why all of us are here is because the system failed us. We're all here because we either got sick ourselves or someone in our life got really sick, and conventional medicine was not enough. Now, don't get me wrong, I'm not against conventional medicine. I love it, I still practice it, but now I recognize its limits. And it started when my wife was diagnosed. I wrote a lot about it in the book. But like the shorthand of it is she was diagnosed with two autoimmune issues. The first one was called PMLE, polymorphous light eruption, which is basically a fancy name for an allergy to the sun, and psoriasis. The first one took her years to get diagnosed and she had to give up her career because of it. It was so debilitating. And the second one, psoriasis, was so severe that she couldn't walk without having her skin crack and bleed. It was a mess. And at the time, all that was offered to us was heavy duty medication. And we knew that there had to be something else. This is why I call it the new method, right? Getting a sense of it now. So it's not just me. Like, my clients know, my game changers know, you listening, you know that there's something else. That's why we're here. We started digging. And you have to remember, I'm old. So the internet was not like now. So digging was a little bit harder. And someone told us about this crazy thing called functional medicine, and we had never heard of it. And we're like, whatever. But we decided to try it, and it worked. And her autoimmune calmed down, and we got our lives back. So I knew I had to bring this to more people, but I didn't even know where to start. I started taking courses, and there's so much information out there. And then I took more courses, and the learning is never ending. Then I got my PhD, and I realized that there's so much information out there that I had to create a method, right? That's where the new method was formed. I created a system, a framework that I use with my clients. And I'm sharing this in my membership in the video. I'm sharing this here, but I'm also sharing it in the TKM membership if you become a member, because it's so important to have a framework so that you don't get lost. All right, so let's jump in. Step one, I already said it. Go to your PCP. Go right now, make an appointment. If you didn't go, go. Go to every specialist that they send you to and do every single test that they give you. Do every single image. But why are you telling me to go to conventional medicine? You just told me conventional medicine failed you. Like, why would I start there? Because you have to use all of the tools, not just one tool. And just like conventional medicine has its limits, functional medicine also has its limits, right? Everything has a limit. So you want all the tools in your toolbox. And it's critical that you get some basic labs and images so that we know that we're not dealing with something more intense, right? Like, you could be tired. So sure, tired might be adrenal fatigue, but tired might be anemia. Tired might be cancer, right? You have to rule out the biggies. Don't be silly. Don't skip this step. Get the basic labs before you consider functional medicine. Start at your PCP. That's where you have to go. Now, if you get a diagnosis, great. You have your answer. Amazing. And you know what to do. And if there's no diagnosis after seeing 27 providers, don't get frustrated. It doesn't mean that your doc doesn't know what they're doing. It just means you don't have a diagnosis yet from that toolbox. It just means you have to go to a different toolbox and search a little bit more. And if you're feeling, really yucky and no one in conventional medicine can find out what's going on, that's actually a blessing, because that means you're not like super duper sick. There's no crazy diagnosis, right? You're not dying. So don't get frustrated. It's just one tool. And now it's time to move on to the next tool. And Now, for those of you who have a diagnosis, like maybe, oh yeah, something is wrong with my thyroid, I do have hypertension. Same thing applies to you, right? It's just one perspective. Now you have a diagnosis, maybe you need some medication, but now you can come to the functional medicine world to get another perspective, another way to address the issue. Okay, so don't worry. Either way, whether you have a diagnosis or not, it's okay. Now is the right time to come into this world. So step two. So that's step one. Don't skip it. Step two, how do I start feeling better? How do I start feeling better? I went to the PCP. I got the diagnosis. I didn't get the diagnosis. I'm here, E. Like, well, what's up? So you have to focus on the root cause. And the root cause of all health issues is inflammation. And we're talking about chronic inflammation, right? Inflammation over time. We're not talking about acute inflammation. We need acute inflammation. It's how we stay alive. We're talking about this chronic underlying inflammation that's in your system all day, even when you're sleeping, and it triggers everything from I-don't-feel-good-itis all the way to chronic disease. And if you want to feel better, you have to manage your inflammation. Okay, so now, how do we do that? But before I said, I wanted to say just like a little caveat to that. Not all inflammation is bad. You need inflammation to stay alive. Like if you get hurt, you fall down, you get hurt, you get cut, that area gets red, it gets swollen. That's good inflammation. That's acute inflammation. That's how we healed. Right? Chronic inflammation is inflammation that doesn't go away. It affects your brain, your stomach, your skin, your joints, your immune system. So the next question is, what caused my inflammation? Is it mold? Is it Lyme? Is it adrenal fatigue? Is it my hormones? I don't know yet. Is it all of them? Is it some of them? The truth is, it could be all of these or none of these. Your journey is not about rushing to a diagnosis because you saw a video on mold or a video on Lyme. It's about slowly and methodically ruling each one of these in or out. But there's one place every single person has to start. You cannot skip this step. You have to start with your gut. Now, I'm not saying that everything will go away just because we start with your gut. And I'm not saying everything is just about the gut. I'm just saying we have to start there because there's no point in looking further. There's no point in doing a mold test if your gut's a mess. There's no point in worrying about Lyme if you have inflammation in your belly at every single meal. Now, you may also have another source of inflammation. You may still have mold. You may still have Lyme, but you won't even be able to handle the treatment for the mold. You won't be able to handle it unless your gut is on point. You won't be able to handle the treatment for Lyme. There's a lot of supplements. You won't be able to handle it. It requires detoxification. It's hard on the belly. It's hard on the liver. You can't go into that with a hot mess. You have to make sure you're healthy first, as healthy as you can be, with your gut as healthy as possible. Now, quite honestly, this is where I lose some people. Like already in step two. Like step one, I went to my doc. Step two, you're telling me I have to change my nutrition. I'm out. Like I'm outie. Because people want the fancy tests. They want the one result that will tell them the one thing that they have to do, the one protocol, the 5 pills that they have to swallow that will fix everything. It doesn't work that way. Okay, if anyone tells you that they have a one size fits all protocol, they're lying. They're lying or they don't know what they're talking about. There are no quick fixes. And anyone who sells you a quick fix is lying. If you're not feeling well, there's probably more than one reason, right? It took you this long to get unwell. There's probably more than one reason. You have to peel away at it layer by layer. The gut is the main source of inflammation. But not only is it the source of inflammation, right? It's not just because your belly is inflamed, but so much is happening in your gut. Like your gut is in charge of your mental health. It creates neurotransmitters, your serotonin, your dopamine. It's in charge of your autoimmunity. 70% of your immune system is right here. It's in charge of your hormones. It's in charge of everything. So absolutely nothing is on point if your gut is not on point. Now, here's another part. Some of you might say, okay, this makes a lot of sense because my stomach's bloated all the time. No matter what I eat, my belly really hurts. So whatever E is saying really makes so much sense. I really should calm down my belly. But some of you listening might be like, this doesn't apply to me. I'm going to skip too. My stomach never hurts. I don't have gut issues. I'm just going to go on to the next episode. This lady doesn't know what she's talking about. Or I'm going to skip to step 3. So I'm here to tell you this. If you don't feel good, you still have gut issues, even if your stomach doesn't hurt. Because the food you eat may not be causing stomach issues, but it could be causing your headaches, your eczema, your skin issues, your anxiety, your joint issues, your nutrition can still be causing inflammation in other parts of your body, even if your GI feels fine. Now, remember I told you earlier about the story about my wife and her autoimmunity and that like it completely destroyed our life? Her stomach was fine. She never has stomach issues. She's never had a belly issue like in her life. Okay. But her nutrition was still causing her autoimmunity because of something called leaky gut. And you'll get to that episode when you go through the membership. So you want to know where to start? This is it. You have to start with nutrition. If you skip this part, the rest of it will fall apart. If you skip it and say, I'm good, I know I have mold, I live in a basement, I see the mold, I'm just going to mold. You do your mold test, great, you're positive. Your treatment will completely fall apart. You will not be able to handle the treatment if your nutrition and your GI is not on point. If you're postmenopausal and you're like, I just need hormones, of course, you probably do need hormones, no doubt. But it'll only get you so far if your nutrition is a mess. So, in this section, by the way, if you're in the section of the membership, I talk about what foods to eat, the inflammation connection, what is leaky gut, the gut brain connection, the gut skin connection, the gut autoimmune connection. Okay, you see the pattern here? The gut and everything. It's all happening in the gut. And then, of course, the section also gives you PDF guides on nutrition. So, just a quick overview of what I mean by getting your gut right, right? This is just a quick overview. Trust me, we have to go much deeper into this, but I want to give you something here. It's the 4R protocol. I didn't invent it. I'm just awesome at it. So the first part is you have to remove. You have to remove the junk, but also remove anything that hurts your belly. So if you have, any type of H. pylori going on, any type of bacteria going on, that's got to go also. So foods, we got to get rid of the high fructose corn sugar. Like if you're still eating that, I don't know what to tell you. You got to get rid of the gluten and dairy because they're known to be inflammatory. Again, not everyone has a problem with gluten and dairy. But if you're here and you're listening, you probably have a gluten and dairy problem. You got to get rid of the corn, the soy. And some people need to eliminate more because just because it's on the healthy food list, if it triggers you, you have to remove it. Like I have people who, onions completely destroy them, and onions are a vegetable, right? So just because it's healthy doesn't mean it's healthy for you. Okay. Some people will have to eliminate legumes. Some people will have to get rid of eggs. Some people have to eliminate nuts. But it does require some customization. But at the very least, the most basic, you have to start with gluten, dairy, corn, soy, and sugar free. Okay. It's like the most basic start. Okay. So you remove the offending agents and then you replace. So a lot of times we need to replace things as well. Now, replacing also means nutritionally. You can't just eat the same thing every day, just like, fine, I'm going to have chicken and broccoli for the rest of my life. No, that's not good. That's not good, right? You don't want to just do that because you're going to create new problems. So you also have to replace. You got the bad stuff out, and you have to put the good stuff in. So many people are so good at removing, but they forget to focus on this part. So you have to put the good stuff in. The green leafy vegetables, the fruits, the colors, the fibers. The more color on your plate, the better. And then you also want to replace with some supplements like digestive enzymes. Or some people need HCl, so you got to put that in there. Then we're on to re-inoculate. Re-inoculate just means we got to put the probiotics in. You don't want to add the probiotics too early because if your belly's a hot mess and you add some more bacteria to it, it's going to be an even bigger mess. So a lot of times people do probiotics a little bit too early and they say, wow, it really hurts me. It was just too early. You have to heal a little bit first. But this is also a time while we're re-inoculating, the 4th R is repairing. Repairing is adding like with supplements that really help that lining. So collagen, amino acids, vitamin A, bone broth. So we're healing that lining, right? And you should notice that you start feeling better. Okay, now that being said, some of you might feel a little worse before you feel better. Okay, the first week might be pretty rough coming off the standard American diet. I mean, some people are out for like a few days. Like it's really like coming off of a drug because the standard American diet is like, it's like detoxing. So don't get scared if the first week is rough. Push through it, push to the other side because it's amazing on the side. And then pay attention. Like what got better? Like what got better? Did your skin clear? Is the ringing in your ears gone? Did the headaches get better? Like start paying attention. Are you sleeping better? Is your belly better? Right? What's happening? Okay, so you're here now. You did all this work. You did the 4. By the way, there is a 5th R, which is like, well, some people call it rebalancing. Sometimes it's reintroduction. So there's a part of like, can I bring some stuff in? Am I balanced? So there is a little bit more to it, but that's a good basic. But you're here now. You did all the gut work. So the next question is, what do I do after I fix my gut? What's next? Well, that answer is it depends. If you read my book, I tell you that some of you, some very lucky ones, God bless you, your journey ends here, right? For so many of you, if you just do step 1 and step 2, your symptoms disappear. You got your nutrition right, your belly feels better, and all your symptoms, your I don't feel good-itis just goes away. You feel amazing. And now, over time with reintroduction, you know which foods trigger your symptoms, and you'll be the master of your own health destiny. And if you're one of those people, if you feel great, amazing. You're done. You're good to go. But remember, keep your plate on point so you can, feel great. No further testing needed, no further questions. And you can continue to watch the rest of my videos to further educate yourself, to tweak things, but you're good to go. Now, the rest of you, you're going to feel better after step 2 without question because you're healing, you're reducing your inflammation, and many of your symptoms will calm down. But probably you're still going to have some symptoms in certain areas that have either not improved at all or improved a little bit. Do not get frustrated. I anticipate this. I expect this. Most people are not 100% just with step 2, just with nutrition. Okay, but now you're ready to take the next steps. Trust me, it would all fall apart if you didn't do this work. This is when you can start talking about the fancy test because now your gut is on point. You got rid of a lot of things you didn't even know you needed to. You got rid of the symptoms, but now your gut's ready. Your liver is good at detoxing. Your inflammation is lower, and you are now ready to handle the rest of it. It has to be done this way. You have to build on top of it. So where do we go from here? Well, that all depends on what symptoms you have. So, for example, you've done all the work and you're still really, really tired. This might be a time to test for adrenal fatigue. It's a saliva test and it'll let you know what your cortisol levels are doing, right? There's a whole section on adrenal fatigue that you can dive into when you binge watch. The company that I like to use for this is called Doctor's Data. I'm not affiliated, I just like them. You do this adrenal test, it's a saliva test. It lets you know what's going on with your fatigue. It gives you what stage of adrenal fatigue you're on. And if your results show that you have adrenal fatigue, then you start to target your supplements on adrenal support on top of all the other work that you did. If you're someone, you did all the work and you're still having belly issues, like they're better, but the belly's still there. Or maybe you're still having skin issues, right? Eczema's a little better, psoriasis, but there's some areas that are not getting better. Flare ups a little better, but it's not 100% calm. You did the 4R protocol, the 5R protocol. So this is a good time to do food sensitivity testing. I like to use, again, I'm not affiliated with any of these companies. I like to use a company called Cyrex. They're really good at running food sensitivity tests, which, by the way, is not the same as allergy testing. Okay, so this cannot be done by your local allergist. This is also a good time to consider stool testing. I like a company called Genova. Again, not affiliated. They do a great test. And this test gives you like a report of what's happening in your microbiome. It's really cool. And when those results come in, you could see, do I have any pathogens? Am I missing certain enzymes? And then you can target your supplements accordingly. It's really awesome. If you're still feeling super tired after all that work, brain fog, brain zaps, internal tremors. If you have it, you know what I mean. If you don't know what I'm talking about, good for you. Ice pick pains, dizziness, headaches, super sensitive to chemicals. You walk in and you just like can't handle if somebody has like a candle lit. That's a good time to consider mold testing. The company I use is called Real Time Labs. And if you're positive for mold, this may be a time to reach out to work with me and my team or another functional medicine provider that knows what they're doing with mold because mold remediation, mold treatment is a little bit tricky. If you did all the work and you still have joint pain and swelling and extreme fatigue after fixing your gut, you might want to consider a Lyme or tick-borne testing. I use a company called IGenix because the usual labs, they're going to miss it. They're going to miss it most of the time. If you have a positive on like a usual lab that you get at PCP, you're positive. But if you have a negative, you're not negative until IGenix says you're negative. I think they should make a t-shirt saying that. You're not negative until IGenics says you're negative. That would be pretty cool. I should pitch it to them. I don't know anyone there, but if you're listening, IGenics, t-shirt, I'll buy it. Anyway, the treatment for that, for Lyme, again, is pretty tricky. So you might want to reach out to a Lyme specialist. But now you're ready for the treatment. You can handle it because you souped up your belly and your liver and your immune system, and you are ready to just get it done. If you're postmenopausal, either due to age or surgery, this would be a good time to do hormone testing. Now, most people who are not menopausal or postmenopausal, if you're younger, most of the time you don't really need hormone testing because once you fix your nutrition, once you fix your insulin and your belly, the hormones tend to regulate themselves. It's pretty awesome. But for the postmenopausal woman, the reality is you're going to need some hormones, and hormone testing is appropriate here. But again, don't jump down that road until you fix your belly. Here again, I like to use doctor's data. I'm a huge fan of BHRT replacement, bioidentical hormone replacement therapy. And you'll need someone to prescribe that for you in your state. If you're in New York and New Jersey, I'm your girl. But if not, you need to find someone in your state that can prescribe. I have game changers all around the country, and I can coach and provide, functional advice. But when we get into prescription and practicing medicine, we're limited by state. So New York, New Jersey, I could do the hormones. If you were listening to this and you were thinking you want hormones after you get tested, just find someone in your state that does BHRT. Okay. So adrenal fatigue, mold, Lyme, hormonal imbalances. You may have none of these. You may have all of these. You may have some of these. But the point is, don't start with these tests. If your symptoms improve once you remove the inflammation by calming your belly, you're done. Don't do these tests. Save your money. Leave it alone. You feel great. Who cares? But if you still have some symptoms, now you're in a state where you can handle the treatment. When I work with my game changers, I do not start with testing ever. Okay, home stretch. We're almost there. The next big question people ask me all the time is, what supplements should I take? And the answer is, I don't know. It depends what's going on in your life, right? There is no one size fits all. There just isn't. So, with that being said, there are 5 basics that I recommend. And then on top of that, you build depending on what's going on for you. So, what are the 5 basics? 1, a really good high quality multivitamin. And yes, I sell it on my website, but get it anywhere. I don't care. Just get a good quality multivitamin. Good quality means there's a lot in it. It's not like 1 milligram. And it doesn't have fillers in it. It doesn't have gluten in it. It doesn't have corn in it. It doesn't have sugar in it, right? A good quality multivitamin. Omega-3. Omega-3 is, you have to have omega-3. It's like the number 1 anti-inflammatory. You just need it in your toolbox, no matter what you're dealing with. Number 3 on the list, vitamin D. Vitamin D. It's not actually a vitamin. It's actually a hormone. It's involved everywhere in your body. It's not just your bones, okay? Get the vitamin D. You can measure your labs. Make sure you don't get too much vitamin D. That's something you can measure with your PCP. Then number 4 on the list is either glutathione or NAC. NAC becomes glutathione because glutathione is the master antioxidant, and you just need that in your life to help you detox. And when you're ready, a good quality probiotic. Okay, but be careful with that one. Remember, don't start that one until your body's a little calmer. Otherwise, it makes a mess. So these 5 things, these are just your basic kind of foundation that you should have on hand, and then you build on top of that. Okay, that's what I like to do. So here's the recap. You're going to start with your PCP. Don't skip that step. Don't skip it. Okay, really important. If you skip that step, pause this, go make the appointment, come back. Okay, none of this is instead of, it's on top of, it's together. Okay, don't listen to just me or anyone. You have to do this. PCP first. After you go to all the specialists, do all the labs, get the images, treat what you have to treat in conventional medicine. Then you're going to come over to this side, the dark side. You're going to fix your belly first. That's step 2, right? 4 R's or 5 R's. And then you're going to see what symptoms you have left. And then you'll determine what test to do. Mold, Lyme, adrenals, etc. If you even need any test, you might not need any test. You might be fine. Okay. Now you could always work with me and my team, or you could do it on your own. Whatever works for you works for me. No matter what, you have to remember that you are a game changer. You are changing the game of your health. Why? because you always knew there was a better way. I'll see you next week.